Hey guys, welcome back to Painless Conversations. Here with their co-hosts, Dr. Christopher Kurian and the one and only Dr. Emil Kurian. Lucky to have you here. So we have a really special episode today, right, Emil? Tell us about it.
Definitely. So obviously it's been on the news everywhere, social media, Instagram, TikTok, but the current event of the unfortunate and terrible, really, murder of United Healthcare CEO Brian Thompson. And the last few days, they've arrested a suspect, Luigi Mangione. And not to really get into the nitty-gritty of that story specifically, but as anesthesiologists and chronic pain doctors, we found it interesting that there was an angle to this story related to Luigi, the current suspect's medical history, right? So with his chronic pain history, his lower back pain, and just how a lot of these things played out and a lot of the new information that's coming out. We felt that as advocates for chronic pain, Chris, that we probably should be able to talk about this. And this is an avenue to be able to introduce this topic to the general public to understand the gravity of it all, right?
Yeah, no, I'm just going to really chime off of what you're saying because I think the general public, doesn't know a lot about chronic pain. And also, they're a little confused. Could some of the things that he was going through, could they have led to what happened, or the pictures of, his spondylolisthesis and the surgical operation that he had? I think people have a lot of questions, and there's a lot of unknowns and things that we don't know either. But like you said, it's a great platform to be able to build off of and be an advocate for patients who suffer with chronic pain.
Yeah, because I think we'll see as we kind of get into parts of this story that this is something that this health issue with chronic pain is something that affects many, many people. And I'm sure as a fellow, you've heard these kind of stories and helped patients through this kind of journey with their chronic pain. So why don't we just get right into it? So with some of the new information that's been coming out about Luigi and his medical history, there's been a few possible posts tying some of his opinions and posts specifically from Reddit under the name of a Mr. Cactus. So I'll read one of the posts here because I think it caught both Chris and I's eye. And it goes, "It can be easy to get caught up in the plethora of horror stories on the internet. When my spondy went bad on me last year, it was completely devastating as a young athletic person. Seemingly all I could read on the internet was that I was destined to chronic pain and a desk job for the rest of my life." Now, Chris, this is probably a story you've heard many, many times. Anything you want to chime in on just from reading and just hearing those few sentences?
Yeah. So I think everyone, whatever life experience that they have, they read that and they hear a lot of different things. And from my experience being a chronic pain fellow and the people that I've seen, the things that are really highlighted to me in that paragraph are how he describes how his functionality is so affected by his pain. He's actually not talking about the severity of his pain if you look at what he's saying. A lot of what he's talking about is his inability to enjoy, the athletic things that he used to do. And he also is frightened about, being in a life of living on a desk job because he's debilitated by his pain.
And do you see this with patients? This is something when patients come to your clinic for the first time or as a repeat visit, do you tend to see a lot of them talk about the things that they've lost from their livelihood, whether that's work, relationships with family, hobbies, working out? Do you see things like that as a pretty regular occurrence?
Absolutely.
Yeah.
So when someone comes into the office, they do tell me how severe their pain is, but really what they mostly emphasize is how their pain has affected their life. And in pain medicine, it's really hard to quantify someone's pain, right? If someone's saying they're in a 9 out of 10 pain or a 3 out of 10 pain, what does that truly mean? How can I quantify that for myself and for other people? And so what we do as pain doctors is that we emphasize functionality and return to the functionality that they hope to gain. And so for us, we really do harp on, what does the patient find meaningful in their life? what are the things that they want to get out of their life, do in their life, whether that's with kids, family. They can get comfortable waking up in the morning, comfortable sitting in their car for a car ride, and so forth.
Yeah.
And we harp on those aspects of someone's life and how we can improve those things. So absolutely, that's those are questions that we mostly ask our patients about, and that we try to find improvement in to say, hey, we are successfully treating this person's pain.
Right.
Because as you know, Emil, it's really hard to get someone from a 9 out of 10 pain to a 0 out of 10 pain.
Right.
And that's not the goal for chronic pain.
Yeah. And I'm
to be
sure,
quite honest with you guys.
Within chronic pain, one of the first things that you talk to your patient about is exactly that. I know when I've been in the chronic pain clinic and a patient comes with 7, 8, 9 out of 10 pain, we first is try to establish a trusting relationship, right? And understanding and kind of describing to the patient, our goal isn't to bring you necessarily from a 9 to a 0. Unfortunately, that's not always realistic, especially with the nature of how chronic pain plays out. So I think what you said is really spot on, because it's taking someone from a 9 to a 5 or a 6 could mean the difference of sitting or laying in bed all the time to playing with their kids or going on walks with their loved one. So that's a really good point. And I think it puts a really good trajectory, Chris, into sort of what I want to talk about next, which is the biopsychosocial model when it comes to thinking about chronic pain. I think for many of us, especially when we're not in the chronic pain world, it's hard to imagine how does a little bit of back pain affect someone so tremendously.
How does if Luigi was suffering from a year and a half of back pain with conservative measures, what does that actually do to someone? How does that affect someone?
And just to clarify, this is not to say that everyone with chronic pain does, things that he's being accused of, which are just terrible. We don't condone that. But, to a different perspective, the toll that chronic pain does take on patients, I think, needs to be said and needs to be said louder. But going back to, like, Chris, what you said, we were talking about the biopsychosocial nature of it, just to quickly kind of clarify for you guys what that means. The best way to think of it is as a Venn diagram, right? There's the biologic perspective of what pain is. So that's exactly what we understand it to be. So it can be back pain caused by something like trauma. It's to the spine or the muscles around the spine, and that could be the initial originator of the pain. Totally an anatomic and biological thing. Then we move on to the psycho portion of this issue, and that is the psychological state of the patient, whether that's pre-existing psychological state, maybe they have baseline anxiety or depression, or they have some sort of PTSD related to trauma, and that's the psychological perspective. And then there's the social perspective, which I think we don't I don't think we harp on enough. And that is this patient's social bonds, whether that's familial, their relationship with their peers at work, or their loved ones, their support group. Because sometimes a lack of that can exacerbate the chronic pain that someone's focusing. So when you take all three of those things into account, then you start to realize it's actually more of this continuous circle. And you have your, I'm just going to say just a general statement. This doesn't apply to Luigi or any specific patient, but you have your initial pain and you have, let's say, back pain, right? And it drives you into thinking, this back pain is really killing me. I can't even go to the gym every day. And now imagine that affecting you for days, weeks, months, years. That's going to have a toll on your psyche, right? Like, it's going to put you into a negative state.
And honestly, and just to kind of go off that, the brain is so complex, right? And there's this, not even theory, but it's proven that the brain has this adaptation called neuroplasticity, which means the brain can adapt and the brain can change due to chronic pain. And so you see that, and you can see these on MRIs and imaging, that once you have a pain signal going up to the brain for a long time, the brain starts to remap and reconnect their synapses, and places like the amygdala, the prefrontal cortex, the ambulacral gyrus, all these things change. That it actually changes in the brain. So it's not just how you feel. How you feel is actually a result of changes that are actively happening in your brain with chronic pain. So sorry to cut you off, but keep
No,
going. Emil.
no, that's actually a really good point, right? Because let's think of the brain as one output. It sends signals obviously to your body, and then it receives signals, and then concordantly gives signals back, right? So you have an injury to your hand, right? You have a real injury, you cut your finger or whatever, and then that's sending signals to your brain to say, hey, there's pain, or there's like an injury. Brain sends signals back, and you have this communication going on, signaling, hey, I have pain in my hand. Now, let's say months later, the injury's been repaired, and there's nothing now physically wrong with the hand. But your brain has been receiving signals, and this is a very gross description of what kind of goes down neuroanatomically, but then your brain perceives that it's been sending signals to that hand for so long that it still continues to send signals saying that you have pain, even though there might not be anything grossly wrong with your hand.
Yeah.
Right? So again, like you said, this field is evolving. We're still understanding, but I think there's a lot of research and a lot of empathy or sympathy we need to show patients, because it might not be something obvious that we're seeing on the surface.
You know, I think the beauty of chronic pain now is that I think it used to be taught in one sort of timeline, which is you learn the biologic issues and you learn things at like a microscopic level and how they affect different organs and your brain and your spinal cord, how that affects the patient, and then how that affects their social life.
Right.
Now we're actually trying to reverse engineer that thinking in chronic pain, which is let's not harp too much on the receptors that are being affected. How about we harp more on talking to the patient about their quality of life and what they want, what they find meaningful in their life. Ask them about it. See what we can tailor in a multidisciplinary approach to improve that. Because at the end of the day, that's what matters, right?
Yeah.
You can talk about the receptors and what's hurt and how that's being affected biologically, but really what's most important and that we sometimes don't do a good job of, not only in pain medicine, but I think all across medicine, is just listening to the patient, hearing what they have to say, giving time to the patient, which I know all patients and healthcare workers are frustrated with right now.
Right.
And once you are able to hear them, hear what they're really internally struggling with, then we can find approaches over time to improve their quality of life. Yeah.
No, I agree 100%. And one last thing I want to bring up with how much, rather than focusing on the receptors or the anatomical issue that be causing the progenitor of this pain, I remember learning, I was doing a chronic pain rotation in pediatrics, and we were talking about how the role of a father or a mother and the child's perception of pain is very much rooted in how they view their parents deal with pain. And I thought that was one of the most fascinating things, because here you have maybe a child who lives with a mother or father with chronic pain, and they see how the let's say the mom perceives pain. As they grow up, their perception of pain is also very much shaped by that. Yep. And I found that very interesting. And again, it continues to contribute to that psychosocial perspective of how chronic pain can or cannot come to be.
Yeah, that's beautiful.
Yeah.
I actually have a personal experience as well.
Oh, okay.
And so, being a chronic pain fellow, I see a lot of patients like this in the hospital.
Right.
And interestingly enough, I had a patient similar to Luigi's age, who came to the hospital with chronic back pain. Okay. And he was actually admitted to the hospital because his chronic back pain got even worse. He was just in an excruciating amount of pain. Mm-hmm. And when I saw him, he was in so much pain that he was defeated. You can see that he was just mentally, physically, emotionally just worn out. He couldn't even tell me how bad his pain was. And that's when you know it's bad. And so this is a patient that we actually did what's called an epidural steroid injection for, because he had a herniation of his disc, similar to what Luigi maybe was struggling with. And so that can sometimes irritate the nerve root. And what we do is we give some steroid around that area to help calm the nerves down and to help, the healing process. Yeah. So we did this for him in the hospital, and we told him, hey, we'll see you in 3 weeks at an outpatient visit, and we'll see how you do. And so I was actually back in our outpatient center 3 weeks later, and I saw his name come up on the list, and I was like, oh, perfect, I'm gonna see him. I think hopefully he's doing a lot better. It'll be nice to see him after he got his injection. Come into the room, really optimistic, and what do I see? I actually see a really frustrated human. And interestingly enough, he actually felt a lot better after that epidural steroid injection. He could move around. He was actually pain-free, but he was super frustrated. And why was that? He was frustrated that, one, he lost his job because he had to spend a week in the hospital. He was really frustrated that for that week, he couldn't play with his daughter or interact with his family or friends. And he was also frustrated that he felt like the medical community kind of let him down. That maybe it took a little too much time, or people weren't spending the time to hear him out in the hospital. And he was so mad that he was physically frustrated, and he actually had to be escorted by security.
Oh, out of the clinic?
Out of the clinic.
Jeez.
But to me, that showed me that, pain, it's not just what he's physically feeling.
Yeah.
His frustration, all the frustration and the disappointment and the expectations that he had in his head really made his experience not good. And it wasn't just pain that was contributing to that.
Right.
And that further showed me that it's not just physical pain that these people are dealing with. They can be dealing with a psychological or social aspect of pain that we just can't quantify.
Right, which is why there's that more of an emphasis, and still is, for the multidisciplinary treatment of this pain, because that's the reality. And I think we can only see so much on the surface when it comes to chronic pain. How much of what this person is carrying in their head, in their just thinking and their mental processing of this pain, we cannot fully understand.
Yeah.
Which is why it's important to get psychiatry involved, social workers involved. When you target all of those kind of things, the patient can truly get better. And it's unfortunate. That's kind of a sad story for this patient. Even like you said, his pain got better, but a lot of his life, parts of his life, were robbed because of that pain and how much he had to deal with.
That's a great point, Emil. Like you're saying, he felt robbed out of a certain experience because of his pain, and I think it's just really important. Personally, I think it's really important to know that, this can happen to anyone.
Yeah.
Chronic pain doesn't discriminate.
No.
Against gender, age, socioeconomic status,
race, any of that.
Yeah. Look at Luigi. He was actually a really physically fit young guy, and he was dealing with
a possibly well-off social life, connections, well-off family,
exactly,
and quote unquote an optimized lifestyle or whatever, but not necessarily
exactly. And that's why I feel like this could theoretically happen to anyone.
Yes.
Anyone successful with so many protective factors that they have around them.
Yeah.
They can still go through these experiences and feel isolated, feel alone.
Yeah.
And I've seen that in the clinic.
Yeah.
Patients who might have the best support system, might have a great life, but their pain robs them of those things. And that's what we try to give them back, right? I think that everyone can learn from the situation that, one is, check up on your loved ones. Yeah. People who are going through situations like this, you don't know what they're dealing with on a day-to-day basis, right?
What advice would you give to maybe non-pain practitioners, or just people, let's start with non-pain practitioners, about dealing with patients who have chronic pain? Because it can be like a steep curve, learning how to handle and appropriately respond to chronic pain patients. What would be, maybe if you had 2 or 3 things to just, some advice for these folks in the general field?
If I had any advice for non-practitioners, one, I would say actually there's a great book to read out there.
Okay.
It's called The Invisible Kingdom. And I think every practitioner, even non-practitioner, people out there should read this book because it's very beautifully written. It's about a woman who is dealing with pain that no one can diagnose. And they later diagnosed it as an autoimmune condition. But she talks about how invisible she felt in the medical field because no one could do a physical exam or an image to find the pain, but she was experiencing it. And she saw the gaps in healthcare, which was that people weren't listening to her. She didn't feel like people were trusting her with
Yeah.
what she was saying.
Yeah.
And they were so often blaming something from a psychiatric nature,
Right.
for depression, anxiety, and that they weren't actually acknowledging her pain. And what I think that people can learn from this is that we need to spend time with our patients and acknowledge our patients' experiences. People are going through a lot of pain, and from a pain doctor, I think what I see is that sometimes we just don't give them the time and the care to really hear them out.
Right.
And I think that, for those of you who might read that book, you can see that if you put your trust in the patient and build a rapport with the patient, you can uncover a lot of truths.
Yeah.
And figure out a lot of ways that you can change a patient's life, even if you don't know exactly what's going on.
Totally.
Sometimes a lot of chronic pain patients, they just want someone to hear them,
Yeah.
to listen to their story.
Yeah.
And
Yeah.
they just want to feel heard.
Yes.
And I
yes.
think that is half of the healing process of chronic pain, is being a listening ear, being patient and kind with our patients in this healthcare space that sometimes doesn't feel like it's constructed to deal with those issues.
Exactly. I couldn't put it better myself. And I think that going along their pain journey it's kind of an honor, right? Because sometimes you meet these meet patients from, they're starting at their lowest low. Everything has been taken from them, at least in their eyes and what they feel. And you work with them sometimes through years to get them to a more stable point. Sometimes it doesn't always end out the way the patient expects, but hopefully some progress is better than none. I remember in our pain clinic, you mentioned the story part, and I think this really, this is one of the stories I talked about in my actually personal statement for fellowship.
Yeah.
And it was about, I was in the pain clinic as an anesthesia resident, and a gentleman came in who's a new patient. He had basically an amputation of his leg, and he was having chronic kind of knee pain. And, I just kind of started from the beginning, like, okay, so tell me about yourself and what's been going on and how this started. And he mentioned that years ago, he was, so he's a homeless gentleman. He was standing on the street, and he was in a hit and run, like a car hit him, and it mangled up his leg, and he had to go to the emergency department. There was some sort of vascular injury, so he had emergency surgery, and they stitched him up, but he's had chronic pain in that leg ever since. And from that moment forward, he was really prescribed pain pills, and he got addicted to pain pills. Unfortunately, he lost his job as an auto mechanic. His wife left him and took rights to his daughter, and he tells me about how he was at one of the lowest situations in his life, and things slowly start to get better, but he never really recovered, especially with the amount of opioids he was on. And showing up to this clinic, the first question I asked him is, so, what are you hoping to get out of improving your pain, functionally? What are you hoping to achieve? He said, dude, if I can just get back to being a car mechanic, I would be so happy. And that was so interesting and inspiring to me, because in my eyes, or the way he said it is I want my sense of self-identity back. I want to feel like I have a purpose on this planet. And when he said it like that, I was like, wow, dude.
Yeah.
But when you hear his story, you can see that this guy is really trying to get better. How can you not be on his side, right? He's really trying to get better. He's ready to put in the work. So we started talking to him about a plan for a steroid injection and helping with the pain. And unfortunately, I'm on a rotation, so I didn't get to follow up with him later. But there was another patient, the next few days, who came in. This was a follow-up patient of my attendings who had been coming to the clinic for many, many years. And this gentleman, very similar story. He was he was a plumber, okay, and he also had a traumatic accident of his leg and a huge amount of opioids. And now 5 years later, he is back working. He's on a minimal amount of oxycodone. He's been getting stable injections, and you can just he just told me the story from the beginning, because I hadn't met him before, and to see where he started and to see where he was at now was just inspiring.
Yeah,
it was amazing, and that's why you have to understand that there are so many aspects to his pain story that we can't forget about when we treat someone like that's pain.
Yeah. I love how you told us that this wasn't like a quick fix.
No,
This was like
never
a
is.
matter of years. And I think
Definitely.
that's really, really important to see because one, setting just clear, realistic expectations with
Yeah.
your patients. Your patients just want you to be real with them.
Yeah.
They don't need you to sob with them necessarily. They don't need you to feel sad for them. They want you to be a beacon of hope for them.
Yeah.
And they want you to be consistent with them
Right.
and realistic with them.
Yeah.
I find that patients respect that the most.
Mm-hmm.
And so, the more authentic you can be with someone
Yeah.
and the more real you can be with a patient, even if it's bad news,
Yeah.
I think that
Totally.
patients really, really respect and appreciate that from their doctors.
Yeah.
And I think that it's hard when you're maybe not in the chronic pain space to when you find someone in your clinic that maybe you just don't know what to offer them.
Yeah.
It's hard to really show that positive beacon of hope.
Right.
But I think that, like you're saying, when you're talking to that patient and he's able to communicate his hopes and desires with you, and you may not be doing anything crazy for him.
Yeah, I'm not getting him back to a mechanic job,
Right?
but
You're not giving him like a new leg.
Right.
You're not giving him a new leg, but what you are giving him is hope.
yes.
And I think that that's the number one thing I would want to say to everyone out there is just be a beacon of hope. Because I think in the medical field and for these patients, people have ignored them. People have kind of lessened their story. And
Yeah.
what they really need is someone to be there for them, look them in the eye and say, I hear you.
Yeah. Yeah. And I think that's really well put, Chris. Like, I was going to say, reflecting on this
Yeah.
kind of talk so far,
Yeah.
but I think you put it beautifully, which is we need to be a beacon of hope for our patients because sometimes they come to us at the lowest of their lows. And if we can acknowledge that we won't know all the answers to solving their pain crisis, but we can at least be a guidance and hopefully get them to a more realistically appropriate place, and hopefully things improve for them from there.
Yeah.
So
I think we can both tell we're pretty enthusiastic about the cause,
yeah,
huh?
yeah. In a strange way, like the unfortunate current events that happened allowed us to bring into light, like, dude, this is something we want to advocate for, right?
Yeah.
We're going into this is our profession, this is our livelihood,
Yep.
and we want to be able to advocate for those kind of patients who their voices aren't always heard.
Yeah,
So
absolutely.
I'm glad to be able to do this. But
Yeah.
guys, if you have questions, if you have your own chronic pain conditions, or you know of friends, peers, your loved ones who go through your own pain conditions, feel free to drop a comment. Let us know. We'd love to hear your stories because the stories we hear aren't the only ones. Many, many people deal with chronic pain on a day-to-day basis, and it would be lovely to hear from you and take your perspective as well on this whole situation.
Yeah.
But
yeah, you're not alone, and we'd love you guys to join us in our journey together. And as Emil's going to be training to be a pain doctor here in the near future, and I'm already in the space. These are the types of people that we want to hear out, and we want to connect with. We want to reach, and so it would be our honor to see you guys, connect with us.
Excellent. Well then, guys, without further ado, we'll see you guys next time on Painless Conversations. Take care.